Substance use and abuse. Psychoactive drugs are chemical substances that can alter arousal, mood, thinking, sensation, and perception. Common properties of psychoactive drugs. Addiction is a broad term that refers to a condition in which a person feels psychologically and physically compelled to take a specific drug. Physical dependence is a condition in which a person's body and brain chemistry have physically adapted to a drug. Many physically addictive drugs gradually produce drug tolerance, a condition in which increasing amounts of the drug are needed to produce the original desired effect. Withdrawal symptoms are unpleasant physical reactions to the lack of the drug, plus an intense craving for it. The drug rebound effect is the experience of withdrawing symptoms that are opposite to the drug's action. Psychoactive drugs influence brain activity by altering synaptic transmission among neurons through increasing and decreasing neurotransmitter amounts, or by blocking, mimicking, or influencing a particular neurotransmitter's effects. Addictive drugs activate the dopamine-producing neurons in the brain's reward system. The initial dopamine surge in response to drug use is the internal reinforcing reward, prompting the person to take the drug again. With repeated drug use, the brain's reward pathways adapt to the high dopamine levels. The availability of dopamine receptors is greatly reduced, and other biochemical changes inhibit the brain's reward circuits, resulting in drug tolerance. The brain's diminished reward circuits also produce depression and negative emotional states. Withdrawal and craving may be caused by reward circuits that have become hypersensitive to the abused substance. Individual responses to psychoactive drugs are subject to biological, psychological, and environmental factors. Drug abuse refers to recurrent drug use that results in disruptions in academic, social, and occupational functioning or in legal or psychological problems. Many factors, including cultural, influence what level of use is considered abuse. The depressants are a class of psychoactive drugs that depress or inhibit central nervous system activity. All depressants are potentially physically addictive. The effects of depressive drugs are additive. Alcohol, used in small amounts, reduces tension and anxiety. Light drinking reduces the risk of heart disease. A survey found that some 11 million people aged 12 and older were dependent upon or abused alcohol. Alcohol depresses the activity of neurons throughout the brain and impairs cognitive abilities such as concentration, memory, and speech, as well as physical abilities such as muscle coordination and balance. The negative effects associated with binge drinking include aggressive behavior, sexual assault, accidents, and property damage. Because alcohol is physically addictive, the person with alcoholism who stops drinking may suffer from physical withdrawal symptoms, the severity of which depends on the level of physical dependence, from the shakes to severe symptoms called delirium tremens, or the DTs. Alcohol lessens inhibitions by depressing the brain centers that govern judgment and self-control. Barbiturates depress activity in the brain centers that control arousal, wakefulness, and alertness. They also depress the brain's respiratory centers. Barbiturates at low dosage can cause relaxation, mild euphoria, and reduced inhibitions. Larger doses produce a loss of coordination, impaired mental functioning, and depression. High doses can produce unconsciousness, coma, and death. Barbiturates include the prescription drug Seconal and Nembutal and the illegal drug methaqualone. Tranquilizers are depressants that relieve anxiety. The effects are similar to, but less powerful than, those produced by barbiturates. Common prescription tranquilizers are Xanax, Valium, Librium, and Ativan, and they can become highly addictive. Often called narcotics, opiates are a group of addictive drugs that relieve pain and produce feelings of euphoria. Opiates include opium, morphine, codeine, heroin, methadone, and some prescription painkillers, such as Oxycontin, Percodan, and Demerol. Opiates produce their powerful effects by mimicking the brain's own natural painkillers called endorphins. The most frequently abused opiate is heroin. Injecting heroin creates an intense rush of euphoria, followed by feelings of contentment, peacefulness, and warmth. Withdrawing from heroin produces unpleasant drug rebound symptoms. Stimulants are at least mildly addicting and all tend to increase brain activity. Caffeine, found in coffee, tea, colored drinks, chocolate, and many over-the-counter medications, increases mental alertness and wakefulness. It is the most widely used psychoactive drug in the world. Nicotine, an extremely addictive stimulant, is found in all tobacco products. It increases mental alertness and reduces fatigue and drowsiness. Amphetamines elevate mood and suppress appetite. Included are benzodrine, dexedrine, and methamphetamine. Methamphetamine or meth is an illegal drug manufactured in home or street laboratories. PET scans of former meth users show a significant reduction in the number of dopamine receptors and transporters. Memory and motor skill problems are common in former abusers and are most severe in those with the greatest loss of dopamine transporters. MRI scans of chronic meth users show tissue loss in the limbic system areas involved in emotion and reward, as well as in hippocampal regions involved in learning and memory. Cocaine is an illegal stimulant, which is snorted or inhaled in a powdered form. A more concentrated form called crack is smoked. Inhaling cocaine produces intense euphoria, mental alertness, and self-confidence, which can last for several minutes. Prolonged use of amphetamines or cocaine can result in schizophrenia-like symptoms called stimulant-induced psychosis, also called amphetamine psychosis or cocaine psychosis. So these drugs can literally drive you crazy. Psychedelic drugs create sensory and perceptual distortions, alter mood, and affect thinking. Mescaline is a naturally occurring psychedelic drug derived from the peyote cactus. Another psychedelic drug, psychoclopin, is derived from the psycholobe mushroom, or we call them shrooms. LSD, lysergic acid dithylamide, is a powerful synthetic psychedelic drug. LSD and psychoclopin are very similar chemically to the neurotransmitter serotonin, which is involved in regulating moods and sensations. The effects of a psychedelic experience vary greatly depending on a person's personality, current emotional state, surroundings, and the other people present. Marijuana is derived from the hemp plant Cannabis sativa and is one of the most widely used illegal drugs. The chemical tetracannabinol, abbreviated THC, is the active ingredient in marijuana. One potent form of marijuana, hashish, is made from the resin of the hemp plant. Researchers discovered receptor sites in the brain that are specific for THC. They also discovered a naturally occurring brain chemical called anandamide, which is structurally similar to THC and which binds to the THC receptors in the brain. Anandamide may reduce painful sensations. Most marijuana users do not develop tolerance or physical dependence. Marijuana and its ingredient THC have been shown to be helpful in treating some medical conditions, as well as preventing the negative effects of chemotherapy. Marijuana interferes with muscle coordination and perception and may impair driving ability. Alcohol intensifies its effects. Club drugs are a loose collection of psychoactive drugs that are popular at dance clubs, parties, and raves. Many are designer drugs, that is, drugs that were synthesized in the laboratory. Ecstasy, which is the chemical MDMA, at low doses has stimulant effects. At high doses, it has mild psychedelic effects. Ecstasy produces feelings of euphoria and increased well-being, as well as feelings of love and openness to others. Side effects include dehydration, rapid heartbeat, tremors, muscle tension, and involuntary teeth clenching and hypothermia. Ecstasy's effects may result in causing the release of serotonin and its ability to block serotonin reuptake. Several studies have shown potentially irreversible damage to serotonin nerve endings in the brain. Long-term effects include depression and problems with memory and verbal reasoning. Dissociative anesthetics deaden pain. At high doses, they can induce a stupor or coma. PCP, known as angel dust or ketamine, special K, produce marked feelings of disassociation and depersonalization. PCP's effects are unpredictable. High doses can cause hypothermia, convulsions, and death. PCP is highly addictive. Memory problems and depression are common effects of long-term use.